So I was hoping that you could tell me and tell other parents what obsessive-compulsive disorder looks like in children and adolescents.
Okay, so obsessive-compulsive disorder in children and adolescents, not surprisingly, is characterized by obsessions or intrusive thoughts or images or feelings that are unwanted. So children may have like worries or fears or thoughts that just pop into their head for no reason that are very upsetting to them. So things like they're afraid of germs or something bad happening to somebody, or that they're going to do poorly in school, or that something, they left the door unlocked and a burglar might come. And compulsions, which are the behaviors that are designed to make these bad feelings go away. So a child that worries about germs or contamination will wash their hands or clean things in order to make this worry about germs or getting sick go away. A child that's afraid of something bad happening, like a robber coming or a burglar coming to the house, will make sure all the doors are locked and that everybody is safe to make this bad concern go away.
Okay. So some of the things you described, like worries and fears, sound like things that all kids deal with. So how does a parent know if their child or their adolescent has a disorder, so the obsessions and the compulsions are a problem in their life?
So parents can tell if the obsessions or compulsions are problems if they're taken to the extreme. So a child that spends an inordinate amount of time worrying about bad things happening, or checking the locks, or washing their hands, is a sign that these typical kind of fears or normal concerns might be problematic. Children that, a common symptom is children that feel they need to erase and rewrite their schoolwork or their school papers so that everything is perfect. There can't be any crooked letters or any crooked words, and they may spend 2 or 3 hours on one paragraph or one paper, erasing and rewriting over and over again to the point where the paper's all messy or ripped, because they might be afraid that if there's something that's not exactly perfect with this paper, that they're going to get a bad grade or that they're going to flunk. Other children with OCD that have contamination fears or cleaning rituals or cleaning compulsions may spend 2 hours in the shower, 1 or 2 or 3 hours in the shower. They may spend 30 or 40 minutes brushing their teeth or brushing their hair to make sure that everything is exactly right. Or they may spend hours cleaning their rooms or arranging their rooms because they need to have everything just arranged in a certain way.
So it sounds like, and correct me if I'm wrong, that it's not just kids who are doing things frequently, but children and adolescents who are really doing these behaviors to an extreme. So it's taking up a large part of their day, impacting their life, their family, schooling. Is that correct?
Yes. So OCD really does, it either can take up a large proportion of time, or it's something that's really going to be interfering. You can also have some OCD symptoms that may not take up a lot of time, but still can be very upsetting or interfering. So some children with OCD have intrusive images. They get pictures or thoughts in their head that are really scary, like maybe doing something bad or hurting somebody or hurting themselves. And these are thoughts that are unwanted. They don't want to do these things. They have no intention of hurting themselves or somebody else, but these thoughts keep coming into their head and making them very upset. And even though the thoughts can be very brief, they still can cause a lot of problems for the child.
So if a family is seeing their child or their adolescent have obsessions, have compulsions, and they're affecting their life in a significant way, what should they do? Whom should they speak with about their concerns?
Well, the important thing is to find a therapist or a mental health professional that has experience working with children and has experience working with obsessive-compulsive disorder. This would typically be a clinical child and adolescent psychologist or a child and adolescent psychiatrist. Okay. Or another professional that has experience in this area.
Okay. What information about treating OCD or obsessive-compulsive disorder should parents be aware of?
Well, the important thing is that there are two treatment approaches for OCD that have been studied and researched very carefully and been shown to have some benefit for children and adolescents with OCD. The first is exposure-based cognitive behavior therapy, and the second is a specific class of medications called the selective serotonin reuptake inhibitors, or SSRIs. Cognitive behavior therapy is really considered the first-line treatment approach. So the recommendation is that in almost all cases, children with OCD should try cognitive behavior therapy first, because it has no side effects, and it's really been shown to have very positive effects in many cases on children with OCD. And importantly also is that once the child has been able to benefit from cognitive behavior therapy or completed treatment with cognitive behavior therapy, the gains tend to last. So in most cases, cognitive behavior therapy would be the preferred treatment to start with for a number of reasons. The first is that cognitive behavior therapy has been shown to be effective in a large proportion of cases, probably more so than medication. And the symptom reduction or the benefits of cognitive behavior therapy, again, have been shown to probably be better than that for medication to some degree. The CBT, or that's which is short for cognitive behavior therapy, may tend to lead to slightly better outcomes. Also, with CBT, once treatment is finished, the children tend to maintain their gains for somewhat longer than with medication. Oftentimes with medication, which can be associated with side effects, once the medication is stopped, the symptoms may come back.
Okay. So you make reference to cognitive behavioral therapy. How would a parent know if the treatment that they're getting or if the therapist that they're seeing uses cognitive behavioral therapy?
Well, the important consideration, the most active ingredient of cognitive behavior therapy is something called exposure plus response prevention. So there are many different forms of cognitive behavior therapy, and there are many forms of cognitive behavior therapy that are used for children with obsessive-compulsive disorder. But only cognitive behavior therapy that's based on exposure plus response prevention has been shown to be effective for OCD. So parents, when interviewing a therapist or trying to find a therapist or talking to a therapist about whether or not that treatment is helpful to the child, should really ask if the therapist does exposure plus response prevention.
Okay. Could you give me an example of what exposure plus response prevention is, or what it looks like?
Well, first let me tell you the rationale underlying exposure plus response prevention. In OCD, when children experience unwanted thoughts or images, like the obsessions, that can obviously be distressing or upsetting or troubling to them. The compulsions or the ritualistic behavior, like the hand washing or the checking or the repeating or the touching over and over again, are then done to make the bad feelings or make the obsessions go away. And the obvious example is a child that's afraid of germs or contamination will repeatedly wash their hands to make these germs or contamination go away. So, when children with obsessions or who are upset by their obsessions engage in the rituals or the compulsions like hand washing, what that tends to do, it tends to reinforce or strengthen the obsessive thoughts. So every time the child gives into his or her OCD by checking or washing or repeating, that tends to make the thoughts stronger and more believable. So what exposure plus response prevention does is try to break the connection between the obsessive thoughts and the rituals or the compulsions. And by demonstrating to children that just because they have an obsessive thought doesn't mean they need to do their ritual. So for example, in treatment, the first thing that we would do is make a list of all the child's obsessive-compulsive symptoms. And then starting with the mildest symptom or the smallest symptom, we would trigger the child's symptom, for example, maybe by putting something contaminated on the child's hand to get him or her to become more anxious feeling. And at that point, the child would want to do their ritual, would want to wash their hands to make the bad feeling go away. But in treatment, we would work with the child or encourage the child to not wash their hands and instead wait and see what happens. And what happens is that the bad feelings or the anxiety goes away by itself. And by repeatedly doing this, doing the exposure or making the child want to do a ritual, but then having them not do the ritual, they learn that their anxiety will go away without having to do the rituals, and that relationship, the connection between the obsession and the ritual is broken. And over repeated trials of doing the exposure plus response prevention, the child learns that the thoughts they have, the scary thoughts or feelings that they have about bad things happening or about germs or contamination or other kinds of things really aren't that bad, and that they'll go away on their own without having to do the rituals.
So it sounds like exposure and response prevention is when a child practices in a graduated way. So what they're fearful of, you don't make them do first, but they build up to it by practicing different strategies along the way. Do I understand that correctly?
Yes, correct. The treatment is done in a way that's very sensitive for children. So we always have the children start with a very kind of an easy or very mild symptom that's easy for them to resist. We don't have them work on their most difficult or most anxiety-provoking symptoms until well on into treatment. In addition, there's a lot of work that we do with the child and the family before we even start working on the specific symptoms. So there's a lot of education about anxiety and about OCD so that they can learn more about what's causing their problem and why they have the symptoms that they have. We talk a lot about methods for reducing anxiety and for helping make them stronger in terms of their ability to handle their OCD or deal with their OCD. In treatment, we also work very closely with parents to give parents the appropriate tools to help them assist their children and help support their children in treatment, and to set up situations at home that are also going to help the children learn how to master or overcome their OCD.
So parents might be part of the treatment and help their children to practice, but they should still be doing that in concert with a mental health professional?
Yeah, it's important that parents work with a mental health professional to best learn how to manage or interact with their child around his or her OCD symptoms. What commonly happens with children with OCD is that they will gradually involve their parents or other family members in their symptoms. For example, making their mother or father wash things for them, or having them avoid certain kinds of food or things at home if the child is afraid that those might be contaminated or covered with germs. They may ask parents to check, for example, the doors or check the locks or check the stove if they're afraid of a burglar or a fire. And it really, over time, can really involve parents and even brothers and sisters in ways that can be very difficult for the family to manage. So one of the goals of treatment is to teach parents and brothers and sisters and other family members or other important people in the child's life how to disengage from the child's symptoms, to not be so involved in the child's symptoms, which will allow the child then to get better with treatment and lead to kind of normal family functioning again. But this can be a little bit tricky, so it really should be done working closely with the mental health professional that is experienced in this area.
Okay. So parents should look for a cognitive behavioral therapist who uses exposure and response prevention. That sounds to be a very important thing that parents should seek. Are there other aspects or things that parents should ask about when looking for a therapist for their child for treating OCD?
Yeah, it's very important that parents are very careful and very knowledgeable when they're looking for a therapist to work with their child's OCD. The therapist, again, must have experience with OCD. The therapist must do exposure plus response prevention for the OCD. And the child must really be knowledgeable in working with children and adolescents. These are all important factors.
So are there other takeaway messages that you would want to give to a parent whose child or adolescent has OCD in terms of what they should be doing as a parent?
There are a number of things that parents should think about when their child has OCD. One of the big misconceptions that we run into is that parents sometimes think that the children are doing the behaviors on purpose, when in reality, in most cases, children with OCD are unable to control their symptoms. The anxiety is just too strong, and when the child says that they need to wash their hands or to check or to repeat certain things, it really is something that oftentimes is beyond their control. So before parents try to do something to stop their children from doing these behaviors, they really should talk to a qualified mental health professional.
Can you tell me how many children and adolescents have OCD, or your best guess?
OCD is pretty common in children and adolescents. Anywhere from about 1% to 3% of children and adolescents in this country have obsessive-compulsive disorder. So if you think about that, if you think of a child, if you're a child that goes to a school with 1,000 children, maybe a medium-sized middle school or small high school, there are probably anywhere from 10 to 20 children at that school that have OCD. So it's actually quite common. And in milder forms, it may even be more common than that.
So how come we don't hear about OCD a lot?
OCD has oftentimes been called the secret disease or the hidden disease because the symptoms can be quite embarrassing. Sometimes they do involve kind of bizarre fears or worries that children might not want other people to know about. So in a lot of cases, children or adolescents are able to hide their symptoms from friends or from classmates or from relatives, and in some cases even from parents. So we don't tend to hear about OCD as often as other disorders, say ADHD or some other things that get more attention.
What should parents look for?
If your parent suspects that their child might have a problem with OCD, there are a number of things to look for. One would be avoiding situations that the children may have used to like not wanting to go to school or avoiding social situations, maybe avoiding being away from home. Sometimes this occurs because the children are afraid that they're going to do their rituals or their compulsions in public settings. Children with OCD, oftentimes, if it's related to perfectionism or writing or schoolwork, may all of a sudden take much longer to do their schoolwork. So an assignment that may take on average 30 minutes to complete may all of a sudden take like an hour or 90 minutes or 2 hours for a child with OCD. Children that tend to erase and rewrite over and over again, try to get things perfect, or really get upset when things aren't exactly right or exactly perfect, that may also be a sign of OCD. Finally, children that spend excessive time, say, washing or showering or bathing or engage in other activities, that also may be a sign that the child has OCD.
Okay. Do we know what causes OCD?
OCD is a biological disorder. It's genetic, so it tends to run in families. But there's also some environmental factors associated with OCD. So if a child is stressed or tired or sick, that may make the symptoms worse. Reactions, if the child is in a situation where others might be reacting to the OCD or putting pressure on the child, that may also make OCD worse. And although some people might say because OCD is a biological disorder, shouldn't you treat it with medication, that's not the case. In fact, the cognitive behavior therapy is the most effective treatment that we have for OCD right now.
So would you say that for children and adolescents who have OCD, there's a fair amount of hope that with CBT treatment or cognitive behavioral treatment, things will get better?
Yeah, there is a fair amount of hope associated with treatment. Cognitive behavior therapy, CBT, has been shown to be effective in a number of cases. Not everybody benefits from it. Not every child is able to do it. There may be certain situations or factors, such as coexisting problems, that might make it difficult for the child to engage in cognitive behavior therapy as the first treatment. Or in some situations, the CBT may be so severe that the child is unable to engage in the treatment. And in these cases, the families might want to consider medication and talk to either a qualified mental health professional about medication or a referral for medication. But between these two treatments, there's a good chance that most children will be able to experience significant benefit and be able to live normal lives.
Can you tell me a little bit about what OCD looks like in the long term, or what parents should expect for their children or adolescents who have OCD in a longer term sense? Right.
So OCD is considered a chronic disorder, which means it tends not to go away by itself. It typically starts around in childhood, so maybe around the ages of 7 to 11. And it, in some cases, will have a sudden onset, so it'll just kind of seems like almost out of the blue. In other cases, it tends to have more of a gradual onset, so the symptoms tend to get worse over time in kind of a slower format. But without treatment, in most cases for children, most kids will just continue to experience the symptoms over time into adolescence and even adulthood. In fact, most adults with OCD had an initial onset of their symptoms during childhood or adolescence. But the good news is that effective treatment can really have a positive impact on children's long-term functioning. So if they're able to benefit from cognitive behavior therapy or even perhaps medication in addition to the therapy, the chances are that they may have a very good long-term prognosis in the sense that they can go on and to lead normal, healthy lives.
And it sounds like, correct me if I'm wrong, a lot of kids or adolescents will learn skills for managing their symptoms that they can draw upon as they age.
Yeah, one of the benefits of cognitive behavior therapy is that children learn skills. They learn strategies for coping with their OCD, for challenging their OCD, and just for general problem solving and coping, which in the long term can really be beneficial. A lot of children that receive treatment actually can serve to strengthen them in many ways by increasing their confidence or their ability to deal with other difficult situations.
One thing I know about other mental health disorders is that sometimes one mental health disorder will co-occur at the same time with another mental health disorder. And so kids are dealing with multiple concerns at the same time. Does that happen with OCD? Do we see that co-occur with other disorders?
Yeah, OCD quite commonly co-occurs with other disorders. The most common other disorders are another kind of an anxiety disorder, such as generalized anxiety or social anxiety fears or separation fears. We also see it occur quite commonly with Tourette's or tic disorders and ADHD. In adolescents or in older children or adolescents or adults, co-occurring depression is also quite common. In fact, most children with OCD, or the majority of children with OCD, will present for treatment or come into clinics with one other disorder, and some kids will even come in with 2 or more other disorders.
Okay. So for some parents, it sounds like they report that they've noticed this in their children for a long period of time, and it might get worse as they get older, or stress might make it more noticeable. For other parents, they might just suddenly notice that their child is experiencing problems with obsessions or compulsions, or it's impacting their life. So if a parent is first noticing these problems or really coming to the realization that it might be impacting their child or their adolescent's life, what's a first step for them?
Well, the first step, if you suspect that your child may have OCD or another problem, is to not panic and not overreact, especially not in front of the child, because that can be very upsetting to the child. But if a parent sees something that doesn't seem right or a change in the child, I think it would be important for the parent just to talk to the child about it. Again, not in an alarmist fashion, but maybe, I've just noticed that you seem to worry about this or that a little bit more than you used to. Do you want to talk about it? Can you tell me what's going on? And try to get some information from the child. Now, commonly children may not want to talk about it or may not want to say anything, either because they're embarrassed or they don't want to upset their parents. But if the parent continues to feel that there's something that concerns them, it would be important to contact, again, a qualified mental health professional, somebody that is an experienced child and adolescent psychologist or psychiatrist or social worker that has experience working with OCD or other kinds of disorders.
Do kids go through phases where they'll have obsessions or compulsions? Meaning, when a parent first notices it, is that the time to contact a mental health professional, or should parents wait to see the course?
If parents see some different kind of a behavior, odd behavior in their child, it probably makes sense to watch it for a little bit of time and not overreact too soon. I mean, unless the behavior is clearly problematic. But if there's something that looks a little bit different, but the parent isn't sure if it's something serious or not, maybe to watch it for a little while, because most kids go through different stages of something where they may be a little more anxious or a little less anxious or a little sad sometimes, or have more active or whatever that might be. And that kind of is normal in kids. But just to watch and continue to monitor, and if things don't get better or if things look a little bit worse, then it might be time to seek out help. The recommendation would be that if a parent sees something that looks like it is interfering with the child's life in terms of school or friends or family functioning, is distressing or disturbing to the child, or is upsetting to them, that would be the time to seek some kind of professional help.
Okay. Well, thank you for your time and for answering questions. I'm sure that many parents will be happy to review this information and to share their concerns with the qualified mental health professional in their area. So thank you again.
Oh, it's my pleasure. Thank you.
All right.